that she shows hunters. And she has hiked 42 national parks, so I was just picking her brain on her favorites, so you guys can do that too when we're all done. I know, like, yeah. She says Bryce is the best. I'm going to have to go do some research on that now. So without further ado, Dr. Poulin is going to talk to us tonight about all the fun things that we vaccinate for and why we vaccinate for them. And she has some terrifying videos.
I do.
Yeah.
Wow. Can you guys hear me? I'm like surround sound.
Yeah.
Who knew?
So there you go.
Yes.
Dr. Poulin.
Thanks. How's everybody doing tonight? You guys ready to have some fun? Gonna learn about some core and risk-based diseases in our horses? Yeah? How many folks here own horses? Hoping everybody, yes. How about cattle? Dogs? Yeah, cats, goats, donkeys, alpacas. So we got a whole variety here. It's wonderful. So yeah, thank you guys for having me. I'm so glad that you guys are able to come out on this night and that the weather has held out for us. My name is Amy Poulin. I am what they call an equine technical services veterinarian. I work for a company called Zoetis. So they're one of the main animal health companies in the world. They're the only animal health company that is strictly dedicated to veterinary medicine, and we are across the entire globe. So my specific function is just for horses and just for the Southeast region. So my background is I am a real veterinarian. I graduated veterinary school in 2004 from University of Pennsylvania. I did an equine internship at Mid-Atlantic Equine Medical Center in New Jersey. And then I moved cross-country to UC Davis, and I did a surgical residency. So I'm actually a boarded surgeon. I went back east. I worked for about 10 years in equine practice, a variety of different roles, and then got scooped up by Zoetis about 3.5 years ago. And now what I do are events such as these. I do horse owner meetings. I do veterinary client education. I cover 8 veterinary schools in the Southeast, so I go and I speak to the vet students. I meet with veterinarians, and I help the veterinarians use the Zoetis products better and in a different way for your horses. And it's all for the benefit of helping wellness care and preventative medicine for your horses. So I was asked to come and speak to everybody tonight about core and risk-based diseases. And in doing so, we wanted really to talk about equine wellness. Okay, so when we're talking about wellness in our horses, it's similar to ourselves having preventative health care for ourselves. So going and having an annual physical exam, annual blood work drawn, making sure our vaccines are up to date. The same goes with our horses, making sure they're dewormed appropriately, have appropriate vaccines, getting their teeth done on a regular basis. And all of these things can be provided by your veterinarian and can be adjusted and tailored based on what you do with your horse, how frequently you show, where you go, how many horses are coming and going, so on and so forth. So it's not necessarily a one-size-fits-all. And so really what we're going to focus on today are vaccines and those core and risk-based diseases that you should probably be a little bit more familiar with and know that your horses are being vaccinated for in this area. So every horse has unique vaccine needs. And what that means is that, you might be an avid performance horse person. You might be in the Western or English discipline, jumpers, dressage. You might be traveling consistently and going all up and down the East Coast to West Coast, maybe international, or on the total opposite end of the spectrum, you just might have a backyard pet that doesn't really do much. It kind of hangs out, you groom it every day, you brush it, you like to feed it treats, or anything in between. Okay, so each horse has different needs based on what you do with them and how much they travel. And you might have other friends that are at your barn if you board somewhere, or you might have boarders at your facility that their horses might go somewhere else and might be potentially carriers of diseases back to the horses at your property. So knowing kind of who your horses are exposed to, where they travel, what kind of critters come through your property. You know, do you have unvaccinated cattle, unvaccinated dogs, skunk, raccoon, deer, rats, mice? I mean, who doesn't, right? Kind of knowing the wildlife that comes through and what diseases they can carry is important. Y'all live in Florida, so I know there's standing water around here. I've seen a ton of it driving around in my travels. And then depending on what breed of horse you have, different associations for showing have different requirements based on their shows. And also the age of your horse. You know, a newborn or weanling is going to have different vaccine requirements versus a middle-aged. And they're going to have different vaccine requirements potentially versus a geriatric horse. Okay, so kind of having that conversation with your veterinarian, talking to them about what your goals are, what the other horses on the property are doing is very important. And the main reason for this is that ultimately we'd like to have an ounce of prevention is worth a pound of cure, right? We'd like to prevent things from happening. Instead of reacting to things that happen, we want to try to prevent those things from happening. Okay? So one of those things is vaccination. Vaccinations are important. One, we need to vaccinate for the appropriate diseases that affect our horses in this area. And then two, we need to get those vaccines into the horse at the appropriate time of year. And we need to do that at a certain time of year to allow the immune system to generate the appropriate response so that the body is ready and in defensive mode before that vector season comes. So is it flies? Is it mosquitoes? Is it, you know, when other wildlife's coming through the property? And then also thinking about biosecurity measures, both for your horse and your property, or how you handle your horse when you're at a trail ride or at a barrel race or at a horse show. And thinking about mosquito and fly control. Okay, these creatures, I don't care which product you use to spray on your horse, it seems like they only last about 5 seconds or less. Or if you've got spray machines or feed-through products or fly predators, you know, they're only as good as what they are. So if we can do what we can do about mosquito and fly control, that will help, because sometimes in various diseases, these little creatures can transmit disease from horse to horse. Okay. I failed to mention that this is a participation. We're not all going to get participation trophies, but we do have some quiz questions, and Courtney here is my colleague within Zoetis who covers this area as well. She's going to hand out some prizes for whoever can guess the right question. So these are kind of interspersed throughout the talk tonight. And the first one is, who can tell me what is a normal temperature, pulse, and respiration for a normal horse? Go ahead.
99 to 101.
Okay. So we have temperature of 99 to 101. Yes. Respiratory rate of, you want to change that to heart rate? Yes. Yes. Respiratory rate would be lower. Yeah, so heart rate in the sort of 28 to 44 range. Yep, you got that. Respiratory rate, what do you think? How fast are they breathing? On a normal average day, not on a super hot day. I heard a 16. 12. All of those are right. 12 to 18, 20-ish. Yes. Horse treats for you. Wow, excellent. So, knowing your horse's vital signs. I know this has nothing to do with vaccines, but it certainly could help you if your horse has a potential problem, either disease or colic or something else, is to know what's normal in your horse, so that if your horse is behaving funny or not eating, might be dull or depressed, maybe its head's hanging low, maybe it's just acting a little weird, you know, there's no reason why everybody in this room can't take their horse's temperature with a digital thermometer. You can get that at the grocery store. You can get a cheap little stethoscope at Rite Aid. practice listening to your horse's heartbeat, easiest way to do that is on the left side, behind their elbow, kind of in their armpit area. Okay? And for respiratory rate, you just literally have to stare at your horse's barrel. Just look at the horse, how frequently their chest opens and closes. If you can't tell that, you can always put a hand in front of a nostril. You can feel the hot air coming out. Okay? So I'd encourage all of you guys to know what's normal. My horse, Roxy, she's a thoroughbred, she's 14. I've had her for 12 years now. She's always 99 to 99.2. Always, 100%. So I know if she is not that, there's something wrong. Her heart rate is always 32. So I know if it's elevated, we got a problem. Same with respiratory rate. She's always around the same. So you got to know what's normal in your horse so that you can recognize when it's abnormal. So if you think there might be a problem, just do a quick temperature, pulse, respiration check. And then you can compare it to what it's been normally. And then you call up your veterinarian and you say, you know, my horse is kind of dull, depressed, hanging head down, his temperature is 101, his heart rate's 52, his respiratory rate is 30, I think something's going on. And your vet will be like, I will be right there. Just hang on, okay? So, fun little fast facts there for you guys. All right, so probably the folks in the back of the room may not be able to read these lists. But what these lists really demonstrate are what we call our core diseases and our risk-based diseases. Does anybody know or the difference between those? Have you ever heard those terms before? Some people yes, some people no. So the core diseases, the list that's here on the left, the core diseases are diseases that every horse, everywhere, at any age, in any state, in the United States, should all be vaccinated for. Doesn't matter what they do, where they go, how they live, where they compete. These are all diseases that every horse should have and receive. Okay? This would include Eastern equine encephalitis, Western equine encephalitis, West Nile disease, tetanus, and rabies. Okay? This is basic core diseases for all horses anywhere. Okay? In contrast, the risk-based diseases are those diseases in horses that would depend on lifestyle, transport, horses that are coming and going, association requirements, and that would include rhinopneumonitis, otherwise known as EHV, which is known as equine herpes virus. They're all synonymous terms. Equine influenza, leptospirosis, strangles, rotavirus, botulism, EVA, that's equine viral arteritis, Potomac horse fever, so on and so forth. You got a question up front?
Yes, I'm sorry to interrupt you. You said Eastern equine
Encephalitis.
encephalitis. It says encephalomyelitis.
Yes, same
What's
term.
the difference?
Same term. Encephalitis, yes, is brain swelling. Encephalomyelitis, brain cord. It's the same thing, yep. Triple E is the other, what most people, lay people will call it. EEE or WEE.
Okay.
Yep. So we're going to go over each core disease. I'm going to show a video for each of these as well. We're going to talk about clinical signs, what a horse looks like, and show a little video. Not a scare tactic, but if anybody is potentially uncomfortable with seeing a horse in a little bit of distress with some of these diseases, I just want to forewarn you that they're not normal horses that we're going to be seeing on a video. Okay? One thing that the core disease that's important to know about core diseases is that exposure cannot be prevented. So 3 out of the 5 of these diseases are spread by mosquitoes. Okay? And the other thing is that these diseases have a high mortality rate in horses, which means that the potential for death is very high. And one in particular is transmittable to humans and is also 100% fatal. Which one would that be? Rabies. Correct. Okay? So that is the reason why these diseases, triple E, WEE, tetanus, West Nile, rabies, that's why these are all core diseases. They have a very high mortality rate in the horse and potentially can be transmitted to you or your family or anybody who has touched that horse. We know in all of these diseases that the vaccines available are highly effective for preventing the disease, and especially when the vaccine recommendations are kept up to date and are done according to the manufacturer's instructions. Most of the time, these vaccines in this area will need to be administered at minimum once a year, preferably twice a year. Rabies usually is just a once a year, but the others are twice a year. Okay, because the vector season in the state of Florida, you guys don't really have a cold winter or a long frost period. Probably never snows here, so these bugs are always around. Okay? So, Eastern encephalitis. I included Western as well, but that's not something that's found east of the Mississippi. So, east of the Mississippi is Eastern encephalitis, west of the Mississippi is Western encephalitis. These are transmitted by infected mosquitoes. And these horses can look a variety of different ways. They're usually dull, lethargic, can't or won't eat. They could be stumbling. They could be weak. They could be circling, have difficulty swallowing, difficulty seeing where things are. They might be running into a wall. Mortality rate for triple E, which is what is here in this state, is about 90%. So that means 9 out of 10 horses will die when they're diagnosed with triple E, or maybe potentially not diagnosed with triple E, but hopefully they would be diagnosed. Okay, annual revaccination at minimum, preferably in this area twice a year, is the best form of prevention. So I'm going to show a little video now of triple E. So this horse is blind. He's running into a wall. He can't see where he's going. Striking out a little bit. He's got a coil set with fluids, IV fluids, hung up from the ceiling to get out of his way and to provide some supportive care. You'll see he's kind of circling around. Doesn't really know where he's at. He's very hypermetric in his front end, meaning he's lifting his legs up really high. Almost looks like he's striking out. Clearly very abnormal behavior. Okay? This is just one example, but triple E can look like a bunch of different things. So basically abnormal behavior, dull, depressed, weak. They may even be unable to rise, down on their side, paddling their legs. They can look like a bunch of different things. Okay. Here's a map of the confirmed cases of triple E in the state of Florida, just from January to now. I accessed this last week. Okay? So you can see where your county is. This is definitely something that all horses in this area should be vaccinated for twice a year, and I know that occurs with this practice. Okay? So let's move on to West Nile. Anybody here of West Nile? Anybody here personally have West Nile? This is something that can be transmitted to humans from mosquitoes. It is not transmitted from affected horses to humans, but certainly we're at risk. Same thing with triple E. Humans can get triple E also from mosquitoes. Okay, so wear your bug spray also. West Nile clinical disease kind of looks sometimes similar to triple E. So it is possible that you could not diagnose a horse by just looking at it. Typically they have a little subtle differences, but not necessarily all the time. So again, a horse could be dull, lethargic, weak, stumbling, not able to eat. They could have seizures, behavioral abnormalities, gait problems. Good and the bad is that horses die about a third of the time. Okay, that's still too much in my opinion, but certainly annual vaccination is the best way for prevention for this disease. I'm going to show you a video of a weanling colt was not appropriately vaccinated or started on appropriate vaccines as a baby. Let's start this from the beginning here. Okay, he's got an IV catheter taped into his neck, kind of stumbling around there. They've got to help him with his balance by holding his tail. Okay, obviously this is not normal and there's a problem going on here. Okay, so this is just an example. Treatment for West Nile, basically supportive care, time, anti-inflammatories. If the horse does survive, these neurological problems could remain lifelong. Okay, that's the unfortunate part. Yeah, question?
If they do get West Nile and they survive, let's say they're lucky and they're no longer side effects,
Yeah.
are they prone, is it possible to be reinfected with it, or once they have it, they're immune to it?
Yeah. So the question is if a horse is infected with West Nile virus and they live and get over it, do they have lifelong immunity? And the answer is no. They do not. Could they be reinfected again? Yes, they could, for sure. Yep, they would probably have some short-lived immunity, like less than a year-ish, but certainly they should continue to be vaccinated and can be prone to developing it again. Yeah, good question. Okay, so moving on to the next core disease is tetanus. Anybody hear of tetanus? Anybody ever seen a case of tetanus? Got one there? Okay, it's pretty crazy, and we'll show a video of a foal in a second. So, tetanus is transmitted through a spore that lives in the environment, in the ground and in the dirt. Okay, it's not everywhere, but it's certainly on different contaminated pieces. The first thing we think of is maybe a horse that stepped on a nail, went in its foot. Any sort of wound, any laceration, anything that horses can get into, run through a fence line, get spooked, get a laceration on their side of their barrel or their leg or something like that. It can go through an open wound or exposed tissue. What these horses end up doing is typically this picture or this image here is what you might see first. Anybody recognize this body part? It's an eyeball. Yes, it is an eyeball. And what is this thing here that's kind of like pink tan color? I think I heard it. Did I hear third eyelid? Yes, yeah. So this is the third eyelid. The third eyelid lives underneath the eyelid in all horses, and it acts like a windshield wiper, and you never see it. So when the eyelids close, this third eyelid windshield wipes back and across the cornea, and its function is to distribute the tear film across the globe, across the eye, so the eyeball doesn't dry out. Okay, so it's kind of like this hidden windshield wiper that goes across the cornea, and when the eyelid opens, it retracts back. So when it is persistently out like this, it's called a prolapsed third eyelid. Very abnormal. You should not see this. Okay. Mortality, unfortunately, about 3/4 of horses that are affected with tetanus will die. There is some antitoxin that can be given and supportive care treatment, but by and large, these horses are not making it. Okay. We can also get tetanus too. If we step on a nail or step on a rusty anything. Most of the time for humans, the tetanus booster is on a 10-year basis, okay, because our exposure rate is not as frequent or as high as horses because they're living outside all the time, most of the time. most of the time we're not bringing our horses inside unless you all have hurricanes here, which I've seen some videos of Florida folks bringing their horses inside. But annual vaccination is certainly at minimum, generally speaking, every 6 months, or if your horse has a wound and has not been boosted in the last 6 months, they should get a tetanus booster if they've got a wound or a laceration. Okay? So let's look at a video of what a horse will look like. It's otherwise known as the sawhorse stance, and you will see why in a second. It's a little granular, but this is a foal. This foal is alive. Okay, this is not rigor mortis after death. You can see he's swishing his tail a little bit, but you can see it's very hyperextended, very rigid, very firm legs. You cannot bend any joints. It cannot stand up. Head and neck super stiff. Question in the back. So the question was, is it painful? I would imagine it would be, yes. I would imagine it would be very uncomfortable. I would imagine it would create a lot of anxiety. I just think about myself. If I was locked, stiff, and rigid, it's also called lockjaw or sawhorse stance. Those are kind of the common vernacular terms for that. Can't imagine that that would feel good or comfortable at all. Okay, so this baby put down. Okay, they cannot recover from this. How do they contract tetanus? So they get a wound, they get a laceration, they step on something that was contaminated with the Clostridial spore that lives in the dirt in the environment. It gets into the wound, gets into the bloodstream, into the circulation. Okay? And then it affects the... I don't know what happened in particular with this one now. Yes.
On a fall like that, if the mother is vaccinated on a regular basis, wouldn't the foal absorb some of the antibodies through the mother's milk?
Yeah, so the question is, what is the transfer of maternal antibodies to the foal from nursing? So it's a good question. And we don't have all the answers for all of these different diseases. Certainly they would have some potential passive transfer of immunity, but it's short-lived, probably a month or 2 months, maybe a little bit longer depending on the situation, but it's not going to be long. And this I don't know how old this little guy is, but certainly in and around the 6-month age is when they should be getting boosted. Yeah. Anytime there's a wound or laceration of a baby, they're treated potentially a little bit different than an adult horse because of that concern that they may not have maternal antibodies. Good question. Yeah. Poor little guy. All right. You guys are hanging in there good. You're getting some good questions. Here's a fun fact for you guys. We have recent data that has been published now looking at incidence of rabies in dogs versus horses. So, did you guys know that rabies, the incidence of rabies in horses is almost 4 times greater than the incidence in dogs? Why would you guys think that is? Because we do not vaccinate all horses. You're right. Yeah. And also horses, for the most part, are living outside and not in our homes and not being brought into our houses. Now, I recognize not all dogs come in. They can be barn dogs or live outside full time. But certainly, people are more used to vaccinating their dogs for rabies. And sometimes, depending on the county you live in, it might even be a requirement to have a dog license or to have the dog registered for that county. Every state's a little bit different. Okay? So, unfortunately, rabies kind of falls through the cracks on some horses. Rabies is transmitted through infected wildlife. So it's not necessarily bats, could be. It's not necessarily raccoons or skunk or deer or dogs. It could be any and all of those things. Fox. This is a map looking at the location of positive confirmed wild and domestic animals in the United States. Okay, the bigger the circle, these big circles here are 100 animals. The little circles are 1 animal. Okay, so look what we got here. And look at this eastern seaboard here. Okay, so horses live in areas where there are confirmed positive wildlife rabies cases. So we need to make sure that our horses are kept up to date with rabies vaccine once a year. Okay, if that time frame lapses or your horse is not vaccinated with rabies and potentially comes down with rabies-like symptoms, we're potentially putting your veterinarian, the technicians, yourself, your family, anybody who's a caretaker for that horse at risk of being infected themselves. And if a positive diagnosis is found, then all those people who had contact with that horse will need to get rabies prophylaxis shots at the hospital. Generally speaking, not covered by insurance and in the tune of $5,000 to $8,000. Yeah, question up front.
Primary way that horses are infected with rabies.
Yeah, so what is the primary way that horses are infected with rabies? It is always some sort of bite. Okay, bite mark. So these animals that are infected with rabies, their behavior is very abnormal. So they always tell you to think about nocturnal animals, animals that are usually active at night, like fox or raccoons, skunk. If you're seeing them wandering around your property during the day, that is not normal. Okay? Similarly, if anybody wakes up and finds a bat flying around in their room, CDC protocol is for you to get rabies prophylaxis, regardless of whether you can find a bite wound on yourself or not. Okay, so there's certainly bats that come into our barns, and any of these, it's basically transmission from the bite wound and the saliva of that infected animal into the horse, and again, it gets transmitted into the blood and gets into the circulation and affects the central nervous system. Okay? Unfortunately, there is no way to diagnose rabies while the animal is still alive. The only way to diagnose it is after the animal has died or been euthanized, and you have to send off brain or spinal cord tissue. Okay? It's kind of gruesome, but that's, if your horse is neurologic and has abnormal behavior, rabies, people kind of think about animals being aggressive, which is one part of how rabies can look, but rabies can also have what we call a dumb form, where they can just be stuporous, lethargic, dull, and not necessarily aggressive, charging, biting, striking. So it can look a couple of different ways. Okay, like I mentioned earlier, mortality 100%. This can be transmitted to people, otherwise known as zoonotic disease, and annual prevention is what we want to do. Okay, here's the next quiz question. Quiz question is, after you vaccinate a horse, how long does it take for the immune system to mount a complete response? 4 to 6 weeks. Anybody else? 2 weeks. Yes, got a winner in the back there. 14 days. Yep, this is right. 14 to 2 to 3 weeks or so. Okay? And why do I say this? Why do I mention this? I mention this because you guys as horse owners, you might be taking your horse off property. You might be going to shows. You might have breed or association requirements for vaccines. You kind of know your travel schedule. Trail rides might have certain requirements too. And it's important to kind of be organized and plan in advance. Because if there are requirements beyond what your horse is normally getting, we want to make sure that your horse is fully protected before it gets to that event. Okay, so if you're vaccinating your horse on a Friday and then leaving Saturday, hauling out 3 to 4 hours, right, and then riding 5 to 8 hours, and then hauling back somewhere, what do you think that does to your horse's immune system? Stresses them to the max, right? So they're being transported, they're in a trailer, that's stressful. They're competing, probably being ridden longer than they normally are ridden at home. Maybe they're staying overnight somewhere in a different place, then being transported back. So I'll use us as an example. How many people here tend to get sick after they go on vacation or they're on an airplane? Yeah, why is that? Because people are gross, and we're all sharing the same area. We're stressed because we're waking up and going to sleep at different times. We're probably doing different activities than normal. Same with horses. So their immune system's stressed, they are stressed, and then they can't host as good of an immune response as they should be able to. So we want to make sure we get vaccines on board well in advance of when we actually need them, so that the immune response can have the appropriate time to develop its response, so that when you take your horse somewhere else, it can appropriately elicit a normal, good immune response to whatever disease it is that it's potentially exposed to. Okay? All right, so we're going to shift focus now. We've talked about core diseases, right? Let's have another little quiz. What are our 5 core diseases? Shout them out. Triple E, West Nile, Tetanus, Rabies, Western Equine Encephalitis. Yeah, Triple E, Tetanus, West Nile, Rabies. You got it. So risk-based diseases. There's a whole host of them, and really all I'm going to talk about tonight is herpes virus, flu, lepto, and a little bit on strangles. Okay, the other ones they are important, but not necessarily as important in this area. If you're going up to the northeast or other areas of the country, yes, for sure, we can certainly talk about it afterwards. Anybody here ever have a horse with a snotty nose or a cough or a sneeze? Maybe a little labored breathing, yeah. So respiratory disease, it's one of the leading causes of infectious diseases in the horse, and it can affect about 10 to 15%, or it can be caused or can cause 10 to 15% of death in horses, which is quite a huge amount, and it can be due to a variety of different diseases that infect the immune system. Okay? We also know that the respiratory disease is one of the most common things that your veterinarian may prescribe antimicrobials or antibiotics for your horse to get. So we're looking at coughing, sneezing, snotty nose. Okay? Any color of snot coming out. White, yellow, usually not green. Green's more of a dental problem. Okay? When we look at the population of horses that have diagnostic tests submitted for what we call a respiratory panel, it looks at a variety of different diseases. This study came out looking at many thousands of samples, and what we wanted to see was what percentage was due to which type of respiratory disease. Okay, so our biggest chunk here, equine herpes virus, number 4. Our second biggest chunk, influenza, 27%. Our third biggest chunk, strep equi, which is the causative agent for strangles. Okay? And then our fourth biggest chunk, equine herpes virus 1. So when we add these up together, we have about 46% of horses, almost half, having a herpes virus, 1 or 4. Now, there's actually 5 different herpes viruses, but the most common ones are 1 and 4. And those are the different types of herpes viruses that are in most major manufacturers' products that your horses are getting vaccinated for. Okay, so equine herpes virus can cause respiratory disease. It can also cause the neurologic form, okay, neurologic herpes. You guys probably have seen articles in regular horse magazines for neurologic herpes. It can cause also late-term abortion in brood mares. So it usually can cause these 3 different diseases. Most commonly, it's the respiratory form, okay? Second most common is flu. Third most common is strangles. So when we're talking about flu, it's a very contagious disease, just like with people. I don't know if anybody's watching the news over this past winter when we're talking about flu In humans, very contagious. Okay, same with horses. How many of you folks have seen your horse sneeze or been sneezed on by your horse? How far do you think those boogers travel with the force and velocity of the horse pushing them out of its nose? It goes everywhere, right? It goes on the stall bars, it goes on the walls, it goes on me, it goes on the table, it goes everywhere, okay? And it lives there. And so then what happens? People come and touch the wall, people come and touch the horse goes and touches the bucket. Kind of, you start becoming a germaphobe when you start kind of thinking about where these germs live in the environment. All another horse needs to do is come by and touch that water bucket, touch that stall door. You can go pat that horse and then go pat another horse, and you have just now transmitted flu to the next horse. Good job. Right? It takes about a day to 3 days for that next horse to start showing clinical signs. Sometimes horses can be shedding the virus and not necessarily be sick. So it can kind of be one of both things. Okay? Usually, most of the time, it's responsible for outbreaks. Now, if anybody's sort of a science junkie like I am, you like looking at microscopic pictures, this is what a normal inside of our lung and our trachea looks like. So when we breathe in, this is both in horses and in humans, we have these little microscopic cilia. And their job is they're constantly fluttering all the time, and they're fluttering from bottom to up and out of the respiratory tract. And they are bringing up bacteria, dust, dirt, debris, and they're bringing it up out of the respiratory tract and out of the horse, okay? And it's a good main protection for the horse. They can transfer bacteria up out of the respiratory tract, mucus, so if anybody's had a really bad cough, and you're coughing a lot and you're producing a lot of mucus, that's like really kind of gross, you might have to swallow it or spit it out. That's what these cilia are doing. When you have the flu, it completely obliterates these cilia. They are gone. Okay, wipes them out completely within like 24 hours. So what happens is your respiratory tract has no self-defense anymore. Then these nice little bacteria up here come and set up shop. And then you end up with pneumonia. Okay? Same way that it happens in people as it does in horses. So the virus attacks these little cilia. These bacteria come in, set up shop. You get a secondary bacterial infection. And what happens is that it takes many, many weeks for the respiratory tract to recover. Your horse may be put on antibiotics to cover the secondary bacterial infection. They're going to have prolonged residual cough. I know myself personally, I've had viruses come through where I'm coughing for what seems like weeks, maybe even over a month. It's horrible. Okay, so for every day that the horse has an elevated fever or temperature from this bacterial infection, they'll require about a week of recovery time. So your horse has a fever for 3 or 4 days. It's going to take about a month for that horse to get back to where it used to be. So if you are actively competing or showing, or you're a trainer and your livelihood is based off of riding this horse, this could be a substantial loss in time for showing as well as riding. And you all know when you're sick and trying to get back in shape, you head back to the gym. It's tough to get back in shape. If you don't use it, you lose it. Okay, so switching gears to herpes virus, otherwise known as rhino or rhinopneumonitis. Can be, like we mentioned earlier, can be respiratory, can be late-term abortion, can be neurologic. Okay? Could be any one of those things. Again, same transmission as flu. Aerosolized droplets of infected boogers, saliva, nasal secretions into the environment. Similar clinical signs to the flu. They're going to have nasal discharge, coughing, sneezing, dull, lethargic, have a fever. You might see, if you have a breeding operation, you might see abortion, you might see neurologic symptoms. The neurologic form is a reportable disease, highly, highly contagious, and I hope that nobody in this room ever has to deal with it. But certainly it can happen. The abortion form can cause abortion storms in broodmare populations, if anybody has breeding horses here. And the respiratory form, again, just like flu, can spread like wildfire through a barn. Okay, vaccination both for flu and rhino, twice a year minimum. Generally speaking, that covers all of our breed association requirements, but we may be doing it more frequently if your horse is traveling more frequently than your average. Okay, so twice a year is a great plan. Okay. This is pretty gross, huh? What do you guys think is coming out of this foal's neck here? Pus. That's disgusting. I mean, this is actually pretty cool for a veterinarian to stick a blade in there and have that all come out, but for an owner and for a horse, it's horrible. Horrible. So, strangles caused by Strep equi. Again, another highly contagious upper respiratory tract disease. By meaning upper respiratory tract, it's usually the head, neck, throat. Okay, so they'll have a snotty nose, they'll have a fever, their lymph nodes underneath their chin, under their mandible, will get very, very swollen. This guy clearly in his throat latch has a big, humongous, infected lymph node abscess. Okay, the abscesses can either pop and drain themselves externally, they can pop and drain themselves internally into the guttural pouches, or we might need to have your veterinarian come out and pop them if they're not popping on their own. Okay? Problem with strangles is what we call these silent carriers. So these are horses that have the Strep equi in their system, but they aren't necessarily showing any signs. Now this seems kind of weird, right? Like how could they be infected but not be showing clinical signs? Well, they might, if they get stressed, if they are transported, if they're shown, if they're otherwise their immune system is immunocompromised or they're stressed in some way, then they can start exacerbating those clinical signs. But in the interim, these silent carriers are depositing this bacteria around your property and potentially infecting other horses. Okay, so these silent carriers are really the bad guys because we don't know that they're sick and we can't identify them. And why would you? Because you wouldn't know. So that's how we end up having sort of recurrent outbreaks, so to speak, on a farm level. Again, strangles is a reportable disease in the state of Florida as well, trying to contain those horses so that they're not shipping out to different farms or different states and then transmitting that disease to other horses. Biosecurity and quarantining that horse and that barn is really important for a period of time until they come up negative on culture. Vaccination is something that can be considered as well, depending on how frequently your horse is moving around, how frequently horses are coming and going off the property. Again, here's a map of our positive counties in the state of Florida just from the beginning of January to now. Okay, and these are just the reported ones. There's probably a ton that are not even diagnosed and not reported as well. Okay. So last on the risk-based disease I'm going to talk about is equine leptospirosis. Anybody ever hear this word before? Yeah? Your cat, maybe you guys have cattle or dogs. Yeah. So equine leptospirosis is one of those, I don't even want to call it a newly emerging disease because it's been around. We just haven't really known much about it in the horse and really haven't been diagnosing it appropriately. So in cattle, we worry about abortion. In dogs, we worry about renal failure. It can happen in pigs as well, renal and liver failure. And what we are concerned about in the horse is they can have both late-term abortion, renal failure, as well as it can be one of the reasons why a horse might develop equine recurrent uveitis, otherwise known as moon blindness. Okay? Now, for reproductive or abortion problems, kidney issues, or ERU. There's many, many, many other things that could potentially cause those same diseases, but lepto certainly should be on that list of what can cause it. It's not the only thing, but it is one of the things. How horses get lepto is it's this little, tiny little coiled, microscopic spirochete. It lives in water and in the soil in the environment. So when your horse is standing in water or has a lake, river, stream running through its pasture, or it is flooded in your area recently, comes up from the environment, and it can be transmitted to your horse through the mucous membrane, so in its mouth, as it's eating grass or kind of drinking that water off the pond or the stream, or grazing where it's kind of muddy, or it can be transmitted. Anybody ever have scratches down on your horse's pasterns where you get that like thick, scabby, crusty, non-healing wounds? Yeah, so any breach in the skin where you have potentially exposed tissue under the skin, it can come in, transmit through the skin that way. So mucous membranes, through wounds, lacerations, scratches area on their lower limbs, gets into the bloodstream, circulates around, and either sets up shop in the eyes, in the kidneys, or the uterus. Generally speaking, it's not all three. It's usually one of those. Okay? It's transmitted to other horses through the urine. Okay? So this can also be a zoonotic disease to people, even lesser known in people. Okay? So dairy veterinarians as well as equine veterinarians who do a lot of reproductive work, if they are dealing with an aborted fetus or they're doing a rectal exam and the horse urinates on them, or there's other issues where urine gets transmitted to the person and then you touch your eyes or your mouth or you have a little wound on your hands or arms, certainly it can be transmitted to people too. Okay? There is only one vaccine on the market to date that is labeled and approved for use in horses for equine leptospirosis. And this is just like our other risk-based vaccines, labeled for annual use, but in endemic areas where it's a problem, twice annually would be the best option. Okay? For more information, there is a website called leptoeqinnovator.com, and you can check out videos, have other links. There's a risk assessment, does my horse need to be vaccinated, so on and so forth. Okay? So biosecurity, we've talked about our risk-based diseases. We've talked about horses sneezing and coughing all over the place. We've talked about stuff being on the stall bars, on you patting horses. So what we want to think about is how can we try to minimize contamination between horse to horse, right? How can we minimize disease in the horse? So we want to make sure the horse is adequately protected by vaccination for our core diseases at minimum and our risk-based diseases depending on lifestyle. We want to make sure that we try to minimize contact with unknown horses or horses with unknown vaccination status. And we want to be careful when we are traveling with our horses, where are they being housed at the showgrounds or fairgrounds or trail events? Who was the last horse that was in that stall? Was that stall appropriately cleaned? Where is this hose coming from? And I think this is one of my next quiz questions. True or false? You should never let a hose touch a bucket. True. Yes. Right here. We got some horse treats for you. And why is that? Yes. Because you're contaminating from one bucket to the next, right? So you don't know where the end of that hose was. If a horse with these upper respiratory diseases, if they're snotting in the water, their saliva is infected, if they've got a booger plop that comes down in the water, if they're nuzzling the water, all of that virus is right there in the water. Then you're taking the hose and you're dunking it in the water, All right, and then you're lifting the hose out, and all that stuff's now on the outside of the hose, and then you go to the next one. You're basically inoculating every bucket down the line, okay? And then you've got a little outbreak situation to deal with. So when I take my horse to a show, I've got my own hose, I got my own buckets. She trailers by herself. And I don't let her go nose-to-nose contact with any other horse, whether they're from my barn or not. I don't let other people touch her or pat her. If I'm hanging out in the warm-up area or waiting to go, I stand away from other horses because I don't want other horses sneezing in my general area. So, I mean, maybe I'm a little crazy and germophobic, but I sort of know now how diseases are transmitted and want to try to minimize exposure if at all possible. Okay? So and this is all under the umbrella of biosecurity. So think about that if you have a boarding farm. Are all the horses vaccinated? Is everybody on the same plan? Is one horse owner vaccinating themselves and one veterinarian vaccinating there and another veterinarian vaccinating there and another horse owner vaccinating here, and they're all kind of doing their own thing? You know, do you think that is as effective as making sure everybody is all on the same plan? Probably a better idea. You know, if you're running or managing a barn or have a boarding facility yourself, you know, work with your veterinarian for what those horses coming on the property should have in advance of getting there. And then work with your veterinarian to get everybody on the same program, which is practical and reasonable for your farm and your horse in that area. Okay? So this is biosecurity while traveling. Best way to fill up a water bucket is just to hold the hose and let the stream arc of water go into the bucket. Who of us actually ever does this? I'm always just putting the hose there and looking on my phone or talking to somebody else, and right? So just think about it. Just think about it. So that's all I got for you tonight. Hopefully you've learned something. I haven't totally blown your mind. You guys are all going to be like rubbing your hands with hand sanitizer when we get home. Okay, hopefully you've committed to memory your core diseases and your risk-based diseases. I know we've got some raffle prizes in the back here, which maybe we'll pull for, and then after that we'll go for some questions. Does that work? So what do we have in this bucket? We have some deworming products. We've got a hat. We got glasses. We got some shampoo, some vet wrap, horse treats, a weight tape. Do you want to pick it out? This is a good bucket. I like this.
Oh, I'm going to be accused of nepotism here.
Uh-oh.
It's not actually my mother. Celia. Woohoo! Celia Evans won the bucket.
Yay! Good job. Congratulations. Could be your other mother.
Oh, yes, but we'll
We have other things to raffle off or no?
I have to ask Courtney, but I think that she brought a really awesome bucket, and there's koozies for everyone, so...
Everybody needs a koozie.
Yes, and who doesn't need a koozie? I mean, especially this
for
time.
beer, for Coke, for water, whatever.
Water, sure. Yeah,
Water.
Yeah,
100%.
Water.
Yes.
Okay. All right, did you guys learn lots? Are you full to the brim with questions?
Questions, let's have them. Yes.
Yeah.
There are two different types of Springhill vaccine that you can get, an intranasal and which one's better?
Which one?
Can you repeat the question?
All right, so the question was, there are two different kinds of Strangles vaccines. There's an intramuscular kind and there's an intranasal kind. So, data and
That's a really
science
good question.
has shown that the intranasal is more effective in terms of eliciting the appropriate immune response and having residual efficacy for a longer period of time than the intramuscular. It's also less reactive than the intramuscular as well. So the intranasal is a modified live virus. It goes up into the nasal passageway and it works in the tonsil area, which is where all the immune system needs to function, is in the palatine tonsils. And so that's when it's delivered up the nose, it shoots back into the back of the throat, coats the tonsils, and that's where we have our appropriate immune response.
The Strangles vaccine, though, it's a very tricky one in terms of administration and some of those sorts of things. So that's why that is a big one where we say that is not a blanket recommendation by us in any way, shape, or form. So we always talk with you very specifically and individually about, does your horse's lifestyle require this vaccine?
Yes, correct. This is why it's on the risk-based, dependent on your specific horse. Yep. Good.
Should we be worried about Venezuelan encephalitis? Yeah. So the last incursion of Venezuelan encephalitis was in 1974. I wasn't even born yet. So...
not in this area, and not if you're not shipping to South America or live on the Texas-Mexico border.
We do, when I lived in Texas for my internship, I went to Texas and I did vaccinate my horse when I went there for Venezuelan, but it is going to come up almost undoubtedly through Texas. And the reason, like she said, is the mosquitoes carry the virus, but an infected horse can't transmit the virus. So it has to be a mosquito, and while, yes, they could probably be on a boat and then get off the boat at Tampa, it's going to be much more difficult. So we're going to have an incursion kind of come up through a land-based system. So Texas will get it first.
Yes.
Yeah.
But if you're shipping a horse to Mexico or South America, you might want to get them on board in advance of getting there. That's probably the very minority of folks, like less than 1% of people are doing that. So,
my horse asked for a vacation to Cancun, but he didn't get it. He got colic surgery instead.
Yeah, I think you guys would probably go there first.
Yeah.
Over your horse.
All right, I saw one back there.
In a 3-year rabies vaccine for dogs, is there any chance of getting rabies vaccine for horses infected, or that'll be working down there?
Yeah, so the question is, there is a 3-year rabies vaccine for dogs. Is there any chance that we'll ever get a 3-year rabies vaccine for horses? And the answer is no. All labeled vaccines for large animals are 1 year, and the reason is their exposure in the environment is significantly higher than your average dog because they're living outside 100% of the time. Even if they're brought into a barn, it's technically considered outside because all those critters can still come into the barn. So there is no known manufacturer that I'm aware of that is working on a 3-year vaccine for that reason. Also, record keeping, it would be a nightmare, which it can be in dogs. And we also have some reported cases of lack of efficacy of the 3-year vaccine in some dogs in some areas. So some veterinarians are actually moving back to the 1-year vaccine. And in order to get a license for 3 years, they have to show a duration of immunity for 3 years. So the amount of time, money, and horses that would be required for both the safety, efficacy, and duration of immunity challenges, which USDA is super heightened about because of the zoonotic potential. It's going to cost $500,000 to $1 million to complete that study, and it's just not in the manufacturer's interest to put that money in there. So I can 99% say, speaking now from a manufacturer's perspective, that it's not going to happen. It's going to be a 1 year. Yeah. Good question.
All right, in the front row there, I saw your hand go up.
No.
Oh, there you go. Look at that.
Wow.
It's like you
We're like
your-
telepathic
Yeah.
here. Front row. That's what happens.
Well, we will be here to answer any questions. Thank you guys all for
Thank
coming
you.
out. We
Yeah.
appreciate every one of you. And again, like I said, any questions, we're here for you. Have a great night.
Thanks, guys. Have a good night.
How quickly does it reach?
All right, so horses, standing water on the